My name is David Tinkelman, and I'm Vice President of Health Initiatives at National Jewish Health in Denver, Colorado. I was a presenter at the Corporate Wellness session this morning. At National Jewish Health, we're an academic medical center, and we have two wellness programs that address the number one and number two causes of death and hospitalization in the United States related to behavior. The first one is a tobacco cessation program for those who smoke, and the second is a program that manages obesity and overweight. National Jewish Health works with private companies across the United States to provide wellness programs to help their employees stop smoking and also to lose weight. This is a major problem for these companies, and it's costing them a lot of money in healthcare expenses. The first program is a tobacco cessation program. It's a quit line. It's a 5-call program in which we help people to stop smoking. And generally, we also provide a pharmacologic support to help with their withdrawal symptoms. The second program is called FitLogix. It's a weight management program. It's an entire year where we work on helping people to understand the balance between calories in and calories out, and so that we help them understand what are good calories and bad calories. And also we focus in on fitness. So our program enables us to measure calories that are burned, something that people do not know about. And so by having this information, it helps them to achieve that goal of losing weight. We have over 40 companies that are clients in the United States right now. Some of them are small companies and some are quite large Fortune 500 companies. Corporate wellness is a relatively old term used for new things, and so what we're trying to do is work with individual companies to change their culture, to help them look at positive behaviors, healthy behaviors. So we're trying to help them get their individuals to stop smoking and have their companies become smoke-free, as well as getting them to make healthy choices related to what they eat and their activity levels. What's happened in the last probably 5 years is there's been a significant amount of information in the lay press, which has got individuals as well as the corporations to focus in on the problem with being overweight and obese and how this leads to escalating healthcare costs. And so it's really not a new trend, but I think the focus is becoming a lot stronger. And with the new Healthcare Reform Act that has just been passed, there'll be an even greater emphasis on healthcare there'll be an even greater focus on wellness programs in the future. Yes, healthcare reform is going to impact us significantly. It's going to increase the demand for wellness programs. With the new incentive part of that new legislation, companies are going to be able to incentivize their employees to participate in these programs, and I think this will increase the demand for these kinds of wellness programs. Well, I think that corporate wellness is really more the wellness of the United States, as the corporations are taking responsibility for wellness and getting their employees to become more actively engaged in it. What it will do is it'll translate to their spouses, their families, etc., and hopefully this will improve the health of the United States in the future. The United States, unfortunately, has really gotten used to fast foods and lack of activity, and with the rising use of the internet, there's less activity outside. Kids are staying inside and playing video games and all types of internet activities, and they're not participating in active sports. This is going to be an unhealthy trend that's going to lead to increased obesity. It's not going to wait for the next generation.